Welcome, and we are sitting here with Associate Professor Donna Geddes, who has just presented a somewhat challenging presentation, all tied up. What does the evidence say about tongue tie? The opening line of your abstract mentions controversy. Could you explain why tongue tie is a controversy?
So the evidence to support frenotomy, which is the surgical release of the membrane underneath the tongue when it's tight or the tongue is tongue-tied, is not considered to be very strong. It's associative. So doing that procedure doesn't necessarily result in improved breastfeeding rates. So that's why it's quite controversial, because the other thing it does is it appears to make mothers more confident about their breastfeeding, and it also reduces pain during breastfeeding. So we have this conundrum between improving breastfeeding in the long term and maternal perceptions that a frenotomy is beneficial.
So it could be seen as we don't know enough about this area, but even without knowing enough, you were commenting on some of the soaring rates of frenotomies occurring both anterior and posterior. And then you alluded to some of the national guidelines that were existing, urging on the side of caution perhaps. But with the soaring rates, even with these guidelines, it seems that perhaps the policy and the practice is not aligned. Could you comment on or expand on why you think this might be?
So I think the older literature that looked at the very anterior tongue tie, where the tongue is tethered and it's very easy to diagnose and see, showed promising results for the mothers. They experienced less pain, they felt things were better. However, the evidence even for that was not considered strong in terms of research integrity. So many countries have decided to say that frenotomy is not supported as an option to resolve breastfeeding problems. However, because of those results, clinicians are now diagnosing tongue tie more frequently, and these posterior tongue ties that you talk about. And so that's why I think if they can see frenotomy as a simple solution to quite a complex problem, and so despite those recommendations, with increased diagnosis comes increased treatment. So I think it's important that we reflect on why that's happening and investigate it.
And so for a clinician or a parent listening, as a researcher, you see these gaps as opportunities for further research, which is obviously wonderful that we can dig in and find more questions and then we can find the answers. But in the meantime, what is it that we could, what is it that clinicians and parents could really take away from your research, from your presentation?
So yes, so we showed that after frenotomy, the babies, despite the mothers experiencing less pain and being more confident about their breastfeeding, the babies didn't transfer more milk, nor did the maternal milk production increase. And in fact, a lot of babies weren't getting what we would consider enough milk. So in view of that, that says to me that there hasn't really been a comprehensive lactation assessment prior to referral for a frenotomy. And that may be that referral sources aren't so skilled at that, for example, some midwives or child health nurses. So I think it's really important for parents before deciding on surgery that they see a lactation expert so that their milk production can be assessed and measured if necessary, that other causes of pain are ruled out, and that we can look at improving breastfeeding before taking the baby to surgery. I think there are a number of things that can be checked off before that, and if they can do that, that may just help rates.
Yeah, so really assessing the breastfeeding and successful breastfeeding from a much more comprehensive, holistic assessment tool. Is this something your research group look to create in general, a checklist or a guideline? Could we see this from you or from your organisation and groups?
I think that's a great way to go, either a decision tree or probably more of a checklist of looking at all of the causes of pain and low milk supply. I think that we can do that in collaboration with clinicians. I think that's really how evidence-based practice should evolve. So we can provide them with that information, and we also have the ability to test the guidelines and protocols. So what I presented today was really probably just the beginning of a conversation and a road to developing this kind of assessment to ensure that only babies are having frenotomies that are most likely to benefit from it.
So really to inform those evidence-based best practices from a comprehensive research background to build those decision trees, as you call them, for to be able to support the mum optimally. So thank you to Associate Professor Donna Geddes for her time, a wonderful presentation, and we look forward to hearing more from your team.
Thanks, Paul.